How do doctors see inside your colon with sigmoidoscopy? Imagine a tiny, flexible tube about the size of your finger that can help doctors peek inside your lower digestive tract. That's what a sigmoidoscopy is. It's a safe and effective way to look directly at the inside of your rectum and the sigmoid colon, which is the last part of your colon before the rectum. This procedure is often used to check for early signs of colorectal cancer, polyps, ulcers, or other abnormalities that might affect your colon health. During a sigmoidoscopy, the doctor gently inserts a thin, flexible tube called a sigmoidoscope into your anus. This tube has a small camera and a light attached at its tip. As the scope advances into your rectum and sigmoid colon, the camera transmits real-time images to a monitor, allowing your doctor to carefully examine the lining of your lower colon. To improve visibility and make navigation easier, the doctor may gently inflate your colon with air, which temporarily expands the space inside. Most people are not heavily sedated for this procedure. You might be offered mild sedation to help you relax, but many remain awake and can follow instructions, such as changing positions to help the scope move smoothly. The entire process usually takes about 10 to 20 minutes. If the doctor spots any abnormal growths like polyps, they can often remove them during the procedure using a thin wire loop attached to the scope. Small tissue samples, called biopsies, can also be taken if something suspicious is seen, helping to determine if further treatment is needed. Preparation is key for a successful sigmoidoscopy. Your doctor will likely ask you to follow a special diet, usually a clear liquid diet, for a day or two before the procedure. You might also need to use enemas or laxatives to ensure your lower colon is completely empty. It's important to follow your doctor's instructions carefully, as proper preparation helps provide clear images and accurate results. Be sure to inform your healthcare provider about any medications you are taking, since some may need to be temporarily stopped. Sigmoidoscopy is generally very safe. The most common side effects are mild and temporary, such as bloating or discomfort from the air used to inflate your colon. Sometimes, if a biopsy is taken, there might be a small amount of rectal bleeding. Serious complications like a tear in the colon are very rare. Most people can return to their normal activities shortly after the procedure. If sedation was used, you will need someone to drive you home. From a colon health perspective, sigmoidoscopy is a valuable screening tool. It helps detect early signs of colorectal cancer and precancerous polyps, which can be removed before they turn into cancer. However, it only examines the lower part of the colon. If abnormalities are found, or if you have risk factors for colon cancer, your doctor might recommend a colonoscopy, which looks at the entire colon. Remember, regular screening is important for colon health. The best approach depends on your personal risk factors, overall health, and your doctor's advice. Maintaining a healthy lifestyle, eating a balanced diet, and following your healthcare provider's recommendations can also help reduce your risk of colon problems. Always consult your healthcare professional for personalized guidance on colon cancer screening and prevention.